This is Group 2's presentation, and this is about our novel drug Ricollin, which is a drug for early onset Alzheimer's. What is Alzheimer's disease? Alzheimer's is a progressive neurodegenerative disease that affects memory, cognition, and behavior. It has 7 specific stages that begin with simple forgetfulness, but eventually it causes severe memory impairment and reduced mobility. Alzheimer's accounts for about 60 to 80% of all dementia cases, and dementia is not one specific disease, rather a general term describing various cognitive deficits. There are 6.2 million cases of Alzheimer's in the United States alone, and it affects 1 in 9 people ages 65 and older. 10% of these 6.2 million cases are early onset Alzheimer's, which is distinguished from later onset Alzheimer's by a diagnosis before the age of 65. People with the alipoprotein E4 gene have an increased risk of Alzheimer's disease, of getting it late onset, compared to people with the APOE E2 or E3 genes. And the inheritance pattern for this is if you have one allele of the APOE E4 gene, you have a 3 times increased risk of Alzheimer's. And if you have 2 alleles of the APOE E4 allele, then you have a 10 to 15 times increased chance of disease. And for early onset Alzheimer's disease, there are 3 specific genes that cause higher risk, and those are the amyloid precursor protein gene on chromosome 21, the PSEN1 gene on chromosome 14, and the PSEN2 chromosome gene on chromosome 1. And Alzheimer's disease is also characterized by a buildup of beta amyloid protein in the brain. In a normal brain versus the Alzheimer's brain, there is in normal brain, there is functional cholinergic signaling, higher levels of alpha amyloid, and minimal atrophy and neuronal lesioning, compared to the Alzheimer's brain, where decay of cholinergic neurons in the forebrain leads to loss of cognitive function and cerebral cortical atrophy, and also higher levels of beta amyloid caused by that amyloid precursor protein on chromosome 21, and higher levels of TAU protein.
So how does Alzheimer's happen? The pathophysiology is not really understood yet, but as we mentioned before, it is generally proposed to be a genetic disease. And though there are multiple biological systems affected by Alzheimer's, we chose to focus on 2 neurochemical systems as the hypothesis for our treatment: the amyloid hypothesis and the cholinergic hypothesis. So first, we decided to target abnormal cleaving of the amyloid protein, which is found in Alzheimer's patients. That leads to the accumulation of beta amyloid plaques, which we mentioned before. And then second, we decided to consider the loss of cholinergic neurons that yields decreased acetylcholine, which is noticeable in Alzheimer's patients. This diminished cholinergic effect is particularly notable in early onset Alzheimer's patients, which we are specifically treating. So it's more effective to prevent the cholinergic degradation than trying to rebuild it, and that's why we decided to treat early onset patients. Our drug, Ricollin, is offered as an oral medication to help modulate specific amounts of drug available. It's taken at night so that the more extreme side effects may occur during sleep, but because nausea is a common side effect, patients should take their medication with dinner or an evening snack. Sacrocolline targets the 2 aforementioned systems and is modeled after 2 more commonly known medications: donezepil, which is taken as an anticholinesterase, and APH-1104, which is a highly successful clinical medication shown to increase the availability of alpha secretase.
This is going to be a brief overview of the previous drugs, donepezil and APH-1104, which are the precursors to our drug. So donepezil, better known as by its market name Aricept, is an oral medication and a cholinesterase inhibitor. And it's used to treat the symptomatic issues associated with Alzheimer's. And even though it's approved for all stages, it's really preferred during onset or early onset, uh, due to the fact that applying donepezil early on can create a snowball effect of benefits later on. It does have heavy side effects, most of them which include nausea and vomiting being the most prominent, although weight loss is also very noticeable, and insomnia tends to be a little harsher when noticed, although it's not as common. And as we can see through this diagram right here, there was a test done with where they used a placebo, 5 milligram dosage and 10 milligram dosage daily of Aricept, and as the diagram shows, the placebo showed no clinical improvements or cognitive improvements in the testing, whereas 5 milligrams a day created some cognitive improvements, but the best results came from a 10 milligram day dosage overall. So for the next drug, APH 1104, it's the more effective analog to APH 0703, or otherwise known as bryostatin 1. It's an alpha secretase modulator, which means it functions through the upregulation of alpha secretase production rather than inhibiting beta amyloid. But because it increases upregulation of alpha secretase, it does consequently decrease the beta amyloid plaques and tau entanglement in the brain and in neurons. And as through efficacy, studies show that it creates increases cognitive performance and leads to cognitive restoration. And it's even responsible for decreasing performance latency. And as we can see through this graph, this basically or essentially just tests the various methods of ingesting the APH 1104. But this is mostly why we chose to go with an oral, just for the fact that even though the others have more effect, they're somewhat negligible in the sense that we can provide an oral medication rather than something that's more complicated to intake.
So secrocoline's mechanism of action is twofold. It is a combination of an anticholinesterase and an alpha secretase inducer. So this anticholinesterase that we provide is reversible and lasts for approximately 10 hours. And what it does is it blocks the activity of the enzyme cholinesterase. This essentially prevents the hydrolyzation of acetylcholine into its inactive form choline. Acetylcholine then stays in the synapse for prolonged periods of time, thus interacting with receptors more and increasing cholinergic signaling in the brain. And the alpha secretase inducer activates PKC production, or protein kinase C, which increases the neurotropic synaptic growth factor, BDNF. This induces the formation of alpha secretase, and an increase in alpha secretase competitively reduces the functionality of beta secretase, as more alpha secretase proteins will cleave more APP proteins. This encourages the production of alpha amyloid proteins instead of a buildup of the harmful beta amyloid proteins. So how does secretoline help? Elevated acetylcholine levels improves cholinergic signaling. The increase in alpha secretase leads to a decrease in the buildup of beta amyloid proteins. So there is a lesser likelihood in developing more plaques. Increased levels of alpha amyloid produces cognitive improvements, and alpha amyloid promotes synaptic formation. Thank you again, and if you unfortunately have a mild case of early onset Alzheimer's, please consider recalling.